Hi, I'm Ajay Hegde, and this is my partner Shubham Dige. We are going to present our data visualization project on US counties life expectancy. The motivation for this project was that we have observed during the COVID-19 pandemic that it has highlighted significant health disparities across the United States, with some counties experiencing much higher rates of cases, deaths, etc., than others. There is a need for better understanding of various determinants of health and the contribution to these disparities. Life expectancy is a key factor for overall health and well-being. We have taken the data set from county health rankings, and it uses a variety of data sources to access each county's health outcomes and factors. Let's get started with the demo. The first one is the choropleth map, which shows the life expectancies across the counties in the United States. And it has been colored according to a heat map, and the life expectancy ranges are displayed above. Let's select the first range, that is 72 to 78, for example, to show the distribution of the counties. We see the distribution is quite evenly matched. The East Coast and West Coast both cover a wide range of counties. Let's select another range, for example, 78 to 84. Yeah, here we see the northern region and the West Coast more densely populated than the East and Southern Coast. We can try checking the other values as well. And as we go, we might see some more disparities. Let's check one more 84 to 91, the next one. Yeah, here we see that there are very few counties left, and those are mostly on the West Coast or in the northern part. On the right side, we also see the life expectancy trends from 2019 to 2023, which is, for example, for this, which shows for 5 years the distribution of life expectancies and how they have changed over these 5 years. We don't see much of a change because the data set is minimal. But we see some outliers. For example, some of the counties have an increasing life expectancy, and majority of them have a decreasing life expectancy, or they have kind of maintained the same. This could be attributed to the fact that we had the COVID-19 pandemic, which reduced the overall life expectancies across the whole world. So we could say that due to this, there would be some observations based on this.
Hi, next one is the bar chart plot. Here we are plotting the most and least healthy counties as per their life expectancies. So across US, these are the top 5 and these are the bottom 5 counties. There is an interesting observation here. We see that of the 4 out of the 5 least healthy counties are from South Dakota. If we make a selection in the choropleth, the counties in the bar chart changes, showing only the life expectancies for those counties over here. Similarly, the next chart is the scatter plot chart. Here we are plotting life expectancy against 4 other factors: median income, physical inactivity, insufficient sleep, and unemployed percentage. Let's check physical inactivity. Here we see that there is a negative correlation between life expectancy and physical inactivity. The more physically inactive they are, the lesser the life expectancy. Similarly, on the insufficient sleep, we see that there is also again a slight negative correlation. If we make a selection over here in the insufficient sleep, let's say those with having a higher life expectancy over here, we see that like basically all the other charts get updated, showing the same thing, that higher life expectancy is evenly distributed across the choropleths, across the counties in the US. And there is not much of a correlation between unemployed percentage and the life expectancy. Next, we move on to the parallel coordinates plot. Let's select the upper half of the life expectancy axis. We see that in the choropleth, these counties are again evenly spread. And if we move the selection towards the bottom, all the other charts keep getting updated at the same time. Again, if we select counties with the higher, like a sedentary lifestyle, we see that they have a lower life expectancy, and also their median income is also less, which is a thing that we observed when we were exploring the data set. And similarly, when they are more physically active, they have a higher life expectancy, and for some reason they also have a higher median income over here. Let's check the vaccinated percentage axis. There's an interesting observation here that on the East Coast side, the number of people who are vaccinated are more than on the west side of the country. And this leads to a higher life expectancy also. And yeah, over here, the uninsured percentage. Yeah. And we can also make intersections over here. So if I select, let's say, uninsured, I can filter it down. Basically, I can narrow the selections down to other factors also. Yeah.
Yeah, so we see that physical, mental well-being, access to healthcare, and income directly affect the life expectancy. Life expectancy has improved over time, but progress has been uneven across regions and counties. Vaccinations and insurances have provided an additional boost in improving the life expectancy. There are some outliers with unusual life expectancies that may indicate unique factors impacting the outcomes, such as population density, huge differences in socioeconomic distributions, etc., that may require additional investigations. That was all from our presentation. Thank you.
Thank you.